Are you wearing your seatbelt? You better buckle up because today we are going on a wild ride. We're going to be talking all things dry mouth, why you have a dry mouth and how to get rid of it. Dry mouth is pretty common with an estimated worldwide prevalence of around 23%. Dry mouth encompasses two conditions: xerostomia, which is the subjective feeling of having a dry mouth, along with salivary gland hypofunction, the objective decrease in salivary gland outflow rate. Now, saliva is mostly water with some glycoproteins and ions thrown into the mix, but boy is it ever important. Saliva is vital for the protection, preservation, and repair of oral tissues. It's vital for tooth remineralization. It's necessary for our digestion and for taste, and it plays a key role in both immune and non-immune defense mechanisms. People with a dry mouth have an increased risk of cavities. They also can develop problems with taste. Always having that sensation of a dry mouth makes one have excessive thirst, the feeling of something being stuck in the back of their throat perhaps. The disruption in defense mechanisms as well as changes to the overall microbiome within the mouth can lead to, well, the development of halitosis, which is the fancy medical term for bad breath. And with the decrease in saliva outflow comes an increased risk for oral candidiasis, aka thrush, a yeast infection within the mouth. People with dry mouth have an 11.5% increased risk of developing oral thrush compared to people who do not have dry mouth. That is how vital good salivary outflow is for our oral health. Dry mouth is even more common after the age of 60. So why exactly do you have a dry mouth to begin with? There are three main reasons one might have a dry mouth. The first and probably most common is medication related. There are so many medications out there that can contribute to a decline in salivary outflow. Take more than one of them and boom. Taking 3 or more medications at baseline puts you at increased risk for having a dry mouth. It's just more likely. Examples of medications that can lead to a dry mouth include antihistamines, especially those that are more sedating, like diphenhydramine, aka Benadryl. Antidepressants, such as those in the class known as tricyclic antidepressants, amitriptyline, for example. As a side note, amitriptyline is a medication that not only is prescribed for depression, but also may be prescribed for the treatment of pain. We prescribe it a lot in dermatology for itch. It does end up being helpful in some cases. Oxybutynin, a medication used to treat urological problems. Isotretinoin, aka Accutane, well known to cause a dry mouth while you are taking it. Medications used to treat blood pressure, especially those known as diuretics. It's not just the medication, it's the dose. Sometimes it might be as simple as lowering the dose in order to alleviate the side effect of dry mouth. And it's not just one medication in many cases, but rather the combination of different medications. It's like a double, triple hitter to the salivary gland. It can really leave you with a dry mouth. If you have dry mouth, definitely talk to your healthcare provider, or providers, plural, if you're seeing more than one doctor, specialist, because it may be worth reevaluating the medications that you're on, if they're all necessary, if some doses can be adjusted. Sometimes, if you're seeing multiple specialists, say you see a cardiologist, you also see an endocrinologist, and you have your regular primary care physician, sometimes maybe medications are added by one doctor and another doctor adds a different medication, and sometimes it's worth raising your hand and being like, do I really need all of these medications, and verbalizing that you're having dry mouth. Despite the narrative that's pushed online, doctors do not like having to put patients on lots of medications, and it is actually highly encouraged to reevaluate the number of medications patients take to limit what's called polypharmacy. This is especially important in older adults who, as I said, after the age of 60 at least, you are a lot more likely to have dry mouth. All right, now the next reason why you might have a dry mouth is an autoimmune condition known as Sjogren's syndrome. Sjogren's syndrome is an autoimmune condition where you get an infiltrate of lymphocytes, cells of the immune system, into the salivary gland such that it is no longer properly functioning, and you get dry mouth. You also can have dry eyes. Sjogren's syndrome, like many autoimmune conditions, primarily affects women, although in some cases men can be affected as well. It affects roughly 3% of the population. The other reason would be head and neck radiation therapy, say for a cancer. Radiation therapy can be really great as a cancer treatment, but unfortunately it can have some bystander effect, including leading to problems with the salivary gland and subsequent dry mouth that is not necessarily reversible. So in order to really fix your dry mouth, you gotta get at the root cause. You have to see your healthcare healthcare provider, they really need to go over all of your medications with you, do a good physical exam, history of the dry mouth, look in your mouth, make sure that there's not a mass impacting like your salivary gland, for example. Refer you to a dentist, have your teeth looked at, go over your medications, maybe check some blood work. There's even a special type of testing called sialometry, mouthful, basically measuring how much saliva you put out. Kind of sometimes involves like a piece of gauze that is weighed and then put in your mouth for a certain amount of time and then weighed again. If you have dry mouth though, what can be done to correct it? Outside of treating underlying root causes like treating the Sjogren's, treating the multiple medications, adjusting their doses, switching to other medications that don't necessarily have these effects, what else can be done? Well, this may sound annoying, but drink more water. Okay, rarely is drink more water helpful medical advice, but it is encouraged here because when you have a decrease in salivary outflow, swallowing mechanisms are going to be impaired and you're also not having that good lubrication in the mouth, foods and things of that sort. You need to drink more water. At least 2 liters a day is recommended for patients who have dry mouth, just to help overall with the mouth. And also just by drinking more water, you help address the issue with you having an increased risk for cavities because the water just kind of keeps things moving along and is really a good thing to be consuming in this case. So drink more water. Also, it's advised that you suck on things like sugar-free candies or chew sugar-free gum. Xylitol sweetened is often recommended, and yes, xylitol is harmful to dogs. That can help stimulate salivary outflow. Now, that being said, if you have Sjogren's, and the Sjogren's is to a point where the salivary gland has been damaged and is no longer able to really put out saliva, and that's not necessarily going to be particularly helpful because you can't stimulate the outflow of saliva if the gland is so damaged it doesn't produce saliva. Then they also make a variety of basically moisturizers for your mouth to lubricate inside the mouth. Oral rinses, sprays, gels. The brand Biotine comes to mind. They have a variety of products aimed at this. They also make sugar-free lozenges, but really any sugar-free candy can be helpful. Those oral moisturizers, they provide short-term relief of the dry mouth, the subjective feeling of having a dry mouth. They also lubricate the mouth, and they can help in the long run with your teeth just by keeping things moving along and moist in there. But in some cases, you might actually need a medication to improve the outflow of saliva. Yes, I know, another medication. The whole goal here was to cut down on medications because many of them cause dry mouth. But there are actually some medications that can lead to improvement in salivary outflow. One medication, for example, is called pilocarpine. Unfortunately, if you have a history of asthma or heart problems, it may not be right for you because it can cause bronchospasms and problems with blood pressure, but that might be an option. There's also a prescription oral spray made by 3M. It contains oxygenated glycerol triester and actually is pretty helpful for short-term relief of dry mouth. But in many cases, like with Sjogren's, for example, or after radiation therapy to the head and neck, it's not as though you can really cure the dry mouth. You just have to stay on top of managing the symptoms, drinking more water, as annoying as it sounds. Some cases, medications might help, but again, in the case of Sjogren's, once the gland gets to a certain point, there's not really much in the way that you're going to stimulate salivary outflow. Some patients find that humidifiers can be helpful, so that's something you might want to incorporate into the home if you deal with dry mouth. But unfortunately, in many cases, dry mouth is not something that can be cured. You kind of are just left managing the symptom, and it can be really debilitating and have a tremendous impact on one's quality of life. I mean, it can get so bad that it messes up your ability to taste food properly. That's what I want to say with regards to dry mouth. I know it is a riveting topic for this Friday, but hey, a lot of people deal with it. It's something we see in dermatology a lot, either related to medications or Sjogren's, which is something that we oftentimes are treating patients with Sjogren's. And we also take care of patients who have had radiation therapy for head and neck cancers. They have skin problems related to the radiation therapy, and they might also have a dry mouth. So this is something that we deal with. We are the doctors of the mucosal membranes. It's not all Botox and fillers. Yeah, I hope this video was helpful for you guys who struggle with this. I know it's not fun. It really can take a toll on your mental health, your overall quality of life. Speaking of the mouth, recently I did a video all about geographic tongue, which I'm going to link on the end slide if you want to check that one out next. But I hope you guys enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.